I'm your host, Roberta Tachi, and today it's a pleasure to have here with me Elizabeth Yarnell. She has worked with hundreds of MS and other autoimmune sufferers in her nationwide clinic, using unique, personalized natural therapies to empower them to reclaim their health. Hello, Elizabeth. Welcome.
Well, hi, Roberta. I'm glad to be here.
Yes. So why don't you start off by sharing a little bit of your story and the connection with you becoming a natural health expert?
Really, that all came out of my story because before I got sick, I really wasn't that interested in health and I wasn't paying any attention to what I ate. In fact, for the entire decade of my 20s, I lived alone, and the only staple foods I kept in my apartment were Diet Coke, Crystal Light, and gummy bears. So I wasn't
Not the
always
best.
right. And it may be not a surprise that after a decade of eating that way, that my body would give out on me. So my story really started one night when I was 29, just about to turn 30 years old in 1999. And I was up late working on a newspaper article that I was writing for the Denver Post. And I thought, okay, I think it's at a pretty good place. I'm going to print out a draft and I'll look it over and make any changes in the morning. And as I was brushing my teeth, I kind of scanned it over and I thought, okay, I see 3 spots I need to make edits in. But the next morning when I woke up and I set my printout pages next to my coffee, I couldn't even read them. It was almost like somebody had snuck in during the night and erased entire sections of the page. What I could read, I really couldn't even understand. It was really scary because this was my profession. This was my livelihood. If I couldn't read and then I couldn't write, what was I going to do?
Yeah, and
Um,
it's also quite scary to suddenly you cannot read what is going on, right? It's a quite
it's
scary
true. And it
experience.
turned out that I had gone blind in my right eye overnight. And I went into the eye doctor's and he diagnosed me with optic neuritis, which is inflammation of the optic nerve. And from there, I went pretty quickly over into an MRI, which I came out of with 17 scars on my brain, indicative of multiple sclerosis.
Wow, yeah, and it's not easy when we have a diagnosis of autoimmune disease. It's not easy. So, and tell me now, how from there you became a natural health expert?
So when I was diagnosed with multiple sclerosis, that's when I learned that 80% of MS patients experience significant disability within 10 years of diagnosis. So here I was about to turn 30 and learning that by the time I turned 40, I would be in a wheelchair.
Oh, so
And
young, yeah.
that was horrifying, horrifying. I had all sorts of things going on in my life that were just about to happen. I had just graduated from graduate school. I was about to get married, all of these things. Being in a wheelchair really didn't fit into my future plans. And the doctors told me, they said, autoimmunity is a mystery. We don't know why it happens. We believe it's incurable. The best that you can do is you can choose to take one of these drugs, very toxic, very strong drugs, every day, or some of them were once a week, some were every day. Um, so I did because my father's a neurologist. He's in the traditional medical system. He very strongly believed I needed to get on one of these disease modifying therapies. Um, but the side effects were horrible.
Mm.
So the goal of these drugs is to slow down the progression of multiple sclerosis. But I was still having regular exacerbations at the same rate, even after I was on the drug and I was on and off it for 3 years or so.
Mm.
Um, but even worse, I began to have hives all over my body. A good day was 30 hives, a bad day was 300 hives. There
Wow.
were days I could not leave the house because my face was just so distorted from hives. They'd always come at the most inopportune times, of course. Um, and they didn't go away until I stopped taking the drug. But The worst side effect that I had, the worst one, was towards the end of my time on the drug, when every time I would inject it, it was an injectable drug, I would have a seizure before the needle was even out of my body. And I finally said, my body is telling me very clearly it does not want to be on this drug. And during this time, I had been trying to study and learn about, well, what could I do to help myself feel better? Because really, my future mattered most to me from anybody else. And it was my then fiance at the time, now my husband of 20 some years, who suggested that maybe what I had been eating might have something to do with it. And I had to admit, he had a point. He was a competitive athlete. He was into organic foods. He really opened my eyes to a lot of things. And that's when I started to try to first improve my diet and my environment and clean up all the toxins in my world. And that's really when I developed my mantra that whole foods are better than processed foods. And ended up developing, inventing, and patenting a technique of cooking whole foods to make it easier for me to eat better, healthier meals without a lot of effort, because fatigue is a hallmark of MS.
Oh, yes, yes. It's like very exhausting, and then you have no energy to cook, and then you would stop in the middle of it. Yeah, yeah. So I want to know more, and if you can talk about, you mentioned about also inflammation and how I think now we are quite aware comparing to, decades ago, of how food has been influencing inflammation. So could you talk about a little bit about the inflammation and how does it look like in the body, and why is it so debilitating?
So anytime you have a diagnosis of autoimmune or an autoimmune condition, all that means is that there is chronic inflammation in the body. So it could manifest in many, many different ways. That's why there's so many different names for different autoimmune conditions, but they all have the same root, which is chronic inflammation. So if we think, well, what does inflammation look like? Well, yes, when I twisted my ankle in a jazzercise class and it blew up, that is inflammation, but that's inflammation from an injury. That's actually the good inflammation, because my body was trying to solidify that joint so it would have an opportunity to heal. What we're talking about is hidden inflammation. So inflammation in the head could look like migraine. It could look like headache. It could look like brain fog. It could look like depression. Inflammation in the sinuses could look like chronic sinus infections, could look like runny or stuffy nose, or having to clear your throat all the time. Inflammation in the chest could look like asthma, could look like high blood pressure, could look like heart issues. Inflammation in the gut could look like bloating, could look like gas or cramping, any kind of digestive issues. Inflammation in the bowels could look like diarrhea or constipation, or
Both.
combination of them, right? Inflammation in the joints could look like fibromyalgia or arthritis. So anything that ends in an itis is medical speak for inflamed. So I was diagnosed with optic neuritis, inflammation of the optic nerve, arthritis, inflammation of the joints, anything that's an itis, gastritis, inflammation of the gastric cavity. Really, medical terminology or diagnosis is solely a description about what is happening. It doesn't tell us anything about why it's happening or how to fix it.
Yeah, so it's you get the diagnosis, and then it's most of the medicines are just like to help with some symptoms, but they are not going toward the cause, or to really cure or help, or even explaining how this happened and why this happened.
You're
So
right. You're right.
yeah, yeah.
And pharmaceutical medicines are not intended to heal. They are intended to suppress symptoms. They're
Mm.
palliative. We have to remind ourselves of that, because if I have a headache and I take an aspirin, it's not healing the cause of my headache. It's just masking it so it doesn't bother me for a while.
Yeah, and this is so, it's very important to understand that. It's a very, in fact, very profitable. With MS alone, I think it was 2017, I had the opportunity to see an article that the profit just with MS medicine was, I think was $15 billion. And this is 5 years ago, and the prediction is much higher. So it's something we have to really be aware of, aware of if we want to really
You're right.
heal
The profit
from.
to the pharmaceutical industry. And in fact, I think I saw somewhere recently that a typical year on an MS disease modifying therapeutic drug, is around $100,000.
Wow. Yeah. Yeah. So let's talk about what can cause this chronic inflammation of autoimmune conditions.
Yes. So the conventional medical community will say autoimmunity happens. We don't know why it happens, but we suspect that you are allergic to yourself. In fact, the word autoimmunity, if we take it apart, auto means self
So
and immunity means allergic. So if we are allergic to ourselves, that's what autoimmunity means. I think that that's not quite right. In fact, I think evolution would say, nay, nay, not possible.
that's
Because,
strange.
right,
Yeah.
if you are allergic to yourself, you would not be able to survive. And in fact, autoimmunity really wasn't known before the Industrial Revolution. So I believe that there are always triggers that are causing the inflammation that we see or that we experience, and that we just have not been looking in the right places. It's kind of like with people who have celiac disease. Once they identify that, oh, their problem is gluten, and they stop eating anything with gluten, they take it out of their world, then they live a pretty normal life without these terrible symptoms. I believe that anyone with an autoimmune condition can identify the triggers that are causing their symptoms, pull them out, and be able to live a pretty good life.
So would you be able to talk in your experience, like some of these causes? We are talking about inflammation, and we are talking about also food. So I know that I feel like each individual is one individual, like our digital in our fingers. But there's certain food in general that cause inflammation that we are becoming more and more aware. Could you talk a little bit about your experience with food and other also causes that cause inflammation in the body?
So I am not a fan of demonizing certain foods or
Mm.
food groups. I have clients who do fine eating wheat, and I have other clients who do not do fine eating wheat. So I don't think that there is a universal diet that is right for everybody. However, there are things I think everyone should avoid. Things like natural flavors or artificial flavors,
Mm.
um, artificial colors, food dyes. I think people should avoid chemical-based fragrances, which is most fragrances that are around, because we have to remember that not only are we exposed to molecules through what we are eating, but our skin is our largest organ. And so everything we touch, we absorb, and anything that we smell is an aroma. An aroma is made up of molecules, even though we cannot see them. So one of my pet peeves are dryer sheets, for example. So what do
Mm.
you see on the commercial? The person going, deep breath. Oh, my dryer sheet makes my clothes smell so good. Well, they are sucking those molecules in down deep into the bottom of their lungs, where they can get stuck and cause irritation for really the rest of your life if you're unlucky. But that's one other way that we are exposed to, I'm going to say, toxic molecules that can fill up our tolerance threshold and tip us over into becoming chronically inflamed or autoimmune.
Yeah, I also feel like some people are more sensitive than others in relation to everything that we are exposed. I see in my family, like my husband and I, we have very different reactions to things, to food, to smells. I'm quite sensitive, so and it the reaction is different for me than it is for him also, and I think that's also important for each person to take into consideration, right?
So everyone has a toxic threshold
Mm,
that basically, um, if we think of our immune system as a bucket, and that all of the insults and assaults from daily life go into this bucket for our bodies to process and release. So that could be anything from over-the-counter pharmaceuticals like Tylenol to antibiotics to alcohol to lack of sleep and high stress, to recreational drugs. All of these things can come in and go um, into our immune bucket. But normally, what happens for a normal human body is that as things go into the bucket, they're processed and pushed out of the body and rejected, basically, and excreted. Um, but for those of us who've tipped over into autoimmunity, our bucket got too full. We could not process it as quickly as we needed to. And so it filled up, and it takes a lot of effort to bring that threshold, that level in your tolerance bucket down far enough where you can feel like you can tolerate a lot of things again. It can absolutely be done 100%. You just have to be really aware and really focused about doing that. But yes, so some people are better processors than others. My environmental working group not recently, a number of years ago, did a study where they tested the cord blood in newborn babies across the country, and they found that newborns are already contain or already have more than 200 chemicals in their bloodstream at the moment of birth, just
wow.
from mothers who live in this environment. And that's even from very aware mothers. So we're at a disadvantage than, say, our ancestors were 200 years ago when there weren't all these chemicals in the environment to already kind of stack the deck against us at birth. So I think that toxins are a big reason that people tip over into autoimmunity. And I think that hidden parasitic infection can also contribute to that.
Yeah, could you talk a little bit more about the parasites? Because I saw you mentioning that parasites has a connection with inflammation and chronic illness and autoimmunity. I think it's everybody would benefit from knowing more about that. Could you tell us more about it?
Yes, we need to raise awareness that parasites are way more frequently found than we have been led to believe. We like to think that we live in a very hygienic modern society, civilization, and that parasites are only found in maybe less developed places on the earth. That is absolutely not true. The CDC estimates that 7 out of 10 adults are carrying around parasites. We can pick up parasites through eating sushi, through eating undercooked pork, through swimming in a lake, a river, or even a chlorinated swimming pool or water park. We can get them through um, playing with our dog, or through changing the kitty's litter box, or through walking barefoot in some places. That's just very, very super easy to pick up parasites. I didn't even cover, like, if you get bitten by a vector like a mosquito or a tick, they can deposit parasites into you. So parasitic infection is super, super common. And when there are parasites in the body, our immune system sees them and says, sound the alert, there are foreign invaders. We need to start the inflammatory cascade to kill off the foreign invaders. Well, the inflammatory cascade works pretty well for virus and bacteria. but not at all for parasites. So we end up in this vicious cycle of inflammation against the parasites, but parasites don't care. And then there's more inflammation against the parasites, but the parasites don't care. So unless you actually address the parasites directly, they don't really have much incentive to leave you.
Wow. And it seems like every common thing, even handling with your dog and that can cause a parasite. I don't even know how to pronounce correctly.
Parasitic infection. One
Parasitic
time, yeah,
infection. Yeah.
I have picked up parasites in so many places. One time, it was from eating at a salad bar in a Pizza Hut in Trinidad, Colorado. So they can be anywhere unwashed or not washed well. Fruits and vegetables can carry parasites. In 2018, a dozen or so McDonald's in the Midwest were infected with, was it Cyclospora or Cryptosporidium? I think it was Cyclospora in their salads. So
Wow.
it can just be really anywhere. And we just need to be aware of the frequency of parasites in our world and take steps that if we have chronic inflammation, we should think about addressing them directly.
Okay, and avoid as much as possible, but at the same time, we cannot be, crazy about. I think when we had COVID, it was already like I remember I was cleaning everything with chemicals. The Clorox was going everywhere. Like I think I said, this is getting insane here. So it's a little bit of a common sense would be good, but also to be aware and be very aware of your condition, your body and how your body is responding. So in terms of inflammation and gut disorders, we're talking about diarrhea, constipation. A lot of people have now they call IBS, which not now, but already for many years, I said, oh, okay, this name is just a name to say a bunch of things that happens because of food sensitivities and also how we respond to it. And so what is your suggestion in terms of dealing with more problems in the gut system?
So there's a lot of factors that go into that. Yes, I think parasites play a big role. I think food sensitivities play a big role, especially if you've had parasites or suspect maybe you had parasites. They've caused a lot of damage. So parasites don't go nicely promenading down through the wide alleyways of your intestines. They they're more like ants in an ant farm in kindergarten. They tunnel their way through their tissues. They leave you perforated and pockmarked and damaged. And so we have to recognize that when there have been parasitic activities, we have to recover from that. And one of the best ways to do that is to start on an anti-inflammatory diet. In my clinic, I design customized anti-inflammatory diets so that you don't have to guess what you should be eating. I use a very advanced, sophisticated, state-of-the-art test called the MRT, which is unlike any of those food sensitivity tests that your doctor might offer you or that you might even see available on television. This is it does not look for antibody creation. If you are being offered a test that looks for antibody creation, don't waste your money, not helpful at all. This looks for mediator release. So for instance, we know that if we have a poison ivy encounter or a bee sting and we take an antihistamine like benadryl, that we can get some relief from the pain that swelling is causing us from that encounter. But histamine is only one of 80 or more mediators that the bloodstream can release upon exposure to what it deems to be a threat. And those threats are often unique to each person. For instance, one of my most inflammatory foods is lettuce. I mean, lettuce.
Lettuce.
Lettuce. But
Who would you think about?
Right. I would never suggest that everybody go off and stop eating lettuce. right? Because most people are not reactive to lettuce. But for me, lettuce causes me great inflammation and, in fact, manifests in symptoms of multiple sclerosis. It makes me wobbly on my feet. I fall down more easily, gives me more of brain fog, all of that kind of stuff.
So yeah, this is seems to me quite important to know which kind of food cause you sensitivity. And so that's a good moment for me to say that we have a gift from Elizabeth today. And there is a button below here to click to get your free inflammation score. And I think that's important for the person first to be aware of this. Can you talk a little bit about this inflammation score, what is going to show to the person? I think the
Yeah.
name already says, but just a little bit.
It's an inflammation quiz, and there are a number of questions, so be sure you get all the way to the end to get your score. But really, it's eye-opening because it will ask you about things that you may not have recognized as being inflammatory. You might have thought, well, that just happens to me. I only poop once a week, or, that's my normal. That is not normal. That is inflammation, right?
Yeah.
All of these questions that it's going to pose that you can reply to, and it'll tally up your score and see how inflamed your body really is. And then you can know how urgently you need to start taking action to bring that inflammation down, because inflammation is damaging to the body all over. It's damaging to the digestive tract, where 80% of our immunity is based, but it's damaging to your joints, it's damaging to everything, and it will shorten your lifespan for sure.
Yeah, and it can cause more serious issue down the road if you don't do anything. Right?
Exactly.
Yeah.
It will snowball on you. If you start off where you're just having constant bloating in your gut, then in a couple years it's going to progress, and now you're going to have pain in your joints too, and it's going to keep progressing, and now you're going to have your vision's going to suffer. You know what I mean? There's just going to be lots of different symptoms that start emerging. It really accumulates on top of each other. That's why we find so many people who have multiple diagnoses of
It's
multiple
true.
autoimmune issues, but really it's all from inflammation. So if we just remember that, one of my mottos is it's all about inflammation, and forget the diagnosis. If we just focus on the inflammation, we can deal with inflammation.
Yes,
It
yes. I think
doesn't matter what your diagnosis is.
it's a much better way of seeing also. And also, if you get your inflammation score, you will receive right away your personal score. It's immediately you can see that. And so please check also the links to the homepage of Elizabeth Yarnell here down the button, and her social media below. So this has been really great. Thank you so much, Elizabeth, for helping us to understand more the effects of inflammation in our body, and also possible things that cause, and especially I think about the parasites. We still need to really raise this awareness about this. This has been really great. Thank you for sharing your expertise with us.